Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. CPR, cardiopulmonary resuscitation, new guidelines for kids and drowning just came out a few months ago. And you might say, well, do I need to learn about CPR in February? I'm sure we're not going to have any pools or anything open until at least May. Can I wait until then? Well, your child can drown in a toilet, in a bucket of water, and even in the dog bowl. Yeah, you know, those little kids, they're so top heavy and balance isn't real good. And if they happen to fall into something where their face is immersed, then they could drown. So these guidelines have just come out to remind people about the process. The process, what is it? Well, back in the last millennium, we did airway breathing and chest compressions, but now it's changed around. So you old dogs out there, you can learn this new trick. Yeah, it's chest compression, airway, and breathing. The new guidelines are emphasizing that any child or any person that seems to be in what's called cardiac arrest, in other words, the heart isn't working and the lungs aren't breathing, they need not only chest compressions first, but they need breaths. I guess some of the older recommendations kind of said, well, if somebody doesn't feel like blowing in somebody's mouth, they don't have to with drowning. But they've changed that, and they say, really, you probably need to blow in their mouth if they're not breathing, and especially if you don't think they've got any heart rate. So it's important for you to take a course. If you haven't done it recently, kids CPR is different than adult CPR, and it never hurts to remind yourself about it, because in the moment when something bad happens, you need to feel as comfortable as you can, know as much as you can for the survival of your child. So join in with all the people who need to take a new CPR course and give that kid a hug.